Welcome to Forbes Talks. Joining me now is Alexandra Levine, technology reporter here at Forbes. Alexandra, thank you so much for joining me.
Thanks so much for having me, Brittany.
You recently reported that some doctors and nurses are losing their jobs over the content they're posting on social media. Can you explain why?
It's a very complicated issue because even 10 years ago, when social media was very new, the biggest problems that you'd be running into with any medical professionals using social media outside of their jobs would be HIPAA. Today, medical professionals are very aware of HIPAA and what the law is and how social media and posts on social media may violate it. What's happening though is a lot of medical professionals are finding themselves in these sticky situations where they're either having disciplinary action taken against them or being fired altogether for things that are not so clear cut as a HIPAA violation. Things like monetizing some of their content, their health content on social media, things like potentially creating conflicts of interest with their practice. But these are things that don't necessarily have, clear guidelines or rules written into social media policies or employment contracts.
Something that you wrote that I found interesting was, quote, as more Americans turn to social media for health advice, medical professionals who double as influencers are towing tricky ethical and professional lines. Where is this line?
There are no clear answers. I think that one thing that I learned in speaking to people is that medical practices different across different fields, medical practices in different locations, medical practices that have, varied levels of medical professionals in them, whether it's an MD or a DO or an RN or an NP, a nurse practitioner, they all have different rules. And even though there are some big bodies like the American Medical Association or the American Nurses Association that put out guidelines, the guidelines are really broad and they talk broadly about what is an ethical line and what isn't. I think broadly, the answer to your question is ethically, you're not supposed to cross lines with patients. Medical professionals are not supposed to cross lines with patients, and they're also supposed to maintain, a professional. They're supposed to carry themselves professionally on social media. But beyond that, it's very difficult to define exactly where the ethical lines are because it varies so widely, based not only on opinion but on what field you're in, what part of the country you're in, what kind of a medical practitioner you are.
So let's say you're a healthcare worker and you start a new job. Are these policies laid out for you, or do they come up once you become a content creator and your employer sees your content?
I think, again, in speaking to all these creators, it seems like it's really a mix of those things, which is why it's so challenging to address. I think for some people, including one nurse practitioner who specialized in dermatology who I spoke to, it seems that there was no clear language in her social media policy about her social media use, but that in her employment agreement, where there's language about conflict of interest and creating competition with the practice, that was ultimately what led to her termination, even though on the surface that has nothing to do with social media.
Can you lay out for us some of the benefits of doctors posting to apps like TikTok?
Absolutely. Well, we know now that 1 in 5 Americans that are seeking help with a health issue are going first to TikTok before they are going to before they are waiting to go to a medical professional. So longer the days where people going in for their once a year visit would wait, potentially 9 months or a year to go and ask their medical question. They're turning to social media platforms, and part of the benefit of these platforms is that they can reach so many people, including people in parts of the country that don't have easy access to healthcare, or people who can't afford healthcare, healthcare altogether. Social media platforms like TikTok are very much democratizing that. The flip side are the dangers inherent with that, right? Because all of these different platforms have different policies for health information, how you deal with health mis or disinformation. And I think that the inconsistencies between those policies, and also there being lots of people who are not actually licensed medical practitioners that are trying to share a lot of health advice on these platforms, and it not being clear kind of who is credentialed and who is not to the average person who's popping open their app and looking at their feed. I think that's where you run into dangers.
And do you think the benefits here outweigh the risks?
It's very hard for me to say. I can't opine on whether the benefits outweigh the risks, but I do think that with the rise of TikTok being one of the most popular search engines in the world, and with the fact that 1 in 5 people are now going to platforms like TikTok before they're seeking help from a medical provider, I think it is incumbent on everybody to at least be able to have the conversation about how there can be benefits. Whether the benefits outweigh the risks, again, is not for me to opine on, but just being able to have the conversation about where the lines should be drawn, how the lines should be better communicated, and also not just fully dismissing medical professionals who use social media as something that they shouldn't be doing, but really trying to get the perspective of people who are very well versed in their fields, who are licensed professionals, and who have been using it in a responsible way, and trying to understand from them what sorts of benefits it has, what kinds of populations they've been able to reach, who they've been able to educate about whatever various procedures they may be able to offer that wouldn't otherwise know. I think it's important to at least start having those conversations, whether we know that the benefits outweigh the risks or not.